Yeah, so my name's Dan. I'm a ST7 vascular trainee in the northeast of England. I currently work at James Cook University Hospital in Middlesbrough, which is the final of the three centres in the northeast that I'll be rotating through during my training. I really enjoy my job, and I kind of first got into vascular when I was a FY1 doctor, and my very first job as a doctor was in the vascular surgery department at the Freeman Hospital. Really enjoyed it. I knew at that point that I wanted to have a surgical career and had chosen my jobs accordingly. I ended up coming back as an F2 to that same department, and then subsequently did another vascular surgery job as a core trainee. And then when I reached that point where I had to decide between doing general surgery and vascular surgery, I just knew that I'd really enjoyed all of my vascular surgery experience up to that point and chose that as the pathway to go down, and have had absolutely no regrets since. So I think it's probably a carotid endarterectomy. It's a procedure which is quite delicate, requires a reasonable amount of finesse, and gives you a really nice display of the anatomy of the neck if you do it right. And at the same time, it is something which patients recover really quickly from, get out of hospital, and you've safeguarded them against the risk of a catastrophic stroke. And that's quite a rewarding thing to have done. And you can kind of see that quite instantly. It's quite gratifying from that point of view. So outside of work, the main thing that fills my time is my family. I'm married, and my husband and I adopted a little boy last year, and he's fantastic, but takes up a lot of time. So I think one of the great things about vascular surgery is the complexity of the disease that we deal with, and the creativity that you have to be able to create a solution. No patient is the same. Their disease is not the same as another patient, even with a very similar condition, and that patient isn't the same, and what they're going to be able to tolerate is not the same. And we're lucky enough to have endovascular and open surgical training, and through the combination of those techniques, there's actually an awful lot of different operations that you can combine to come up with a personalised solution for that patient, and that really keeps your job interesting and it keeps it challenging. And I think that's something which is probably fairly unique to vascular surgery. And then hopefully you can put these things together and come up with a solution which will get that patient better and get them out of hospital, and you will have achieved something quite measurable. And there's often a good evidence of your success in terms of imaging, and then the patient's symptoms improving, their wounds healing, and when that goes well, it's very rewarding. I think we deal with a very challenging group of patients, and unfortunately those are not people who we're always able to help to the extent that we'd like to be able to, just due to the very challenging the nature of the disease that they present with. And I think vascular surgery has a bit of a reputation of us spending a lot of time for not much gain in some people. And I think actually that's not really true, and the viewing of one of the endpoints of vascular surgery being an amputation, viewing that as a failure is not correct, because actually amputation can solve pain, it can solve infection, and it can improve people's quality of life beyond what they had before. But not everything that we do ends in immediate success, and that can be quite difficult to deal with, especially when you see patients over a very, very long period of time as they recover from their vascular problem.